Hello, Assalamu alaikum guys. We are on chapter number 6, Saunders. We are reading word by word in Sounder book, and today we are going to read Health Insurance Portability and Accountability Act. As you see this pyramid point, I always say this is going to be tested in exam or might be it has been tested. So this is we have to know very important description. So let's read and word by word. The Health Insurance Portability and Accountability Act HIPAA describes how personal health information PHI may be used and how the client can obtain access to the information. So here they are giving knowledge about health insurance and personal data and how it can be used. So number 2, PHI personal health information includes individually identifiable information that relates to the client's past, present, or future health treatment and payment for healthcare services. So now you know guys what is personal health act, personal health information. Now this is 3. Number 3, the Act requires healthcare agencies to keep PHI private, provides information to the client about the legal responsibilities regarding privacy, and explains the client's rights with respect to PHI. Number 4, the client has various rights as a consumer of healthcare under HIPAA and may client request may need to be placed in writing. A fee may be attached to certain client requests. Complain if the client believes that privacy rights have been violated. Number B. So it was A. Now I'm going to read number B. Client's rights include the right to the following. Number 1. Inspect a copy of PHI. Number 2. Ask the healthcare agency to amend the PHI that is contained in a record if the PHI is inaccurate. So we are reading Health Insurance, chapter number 6. Let's go here. Number 3, request a list of disclosures made regarding the PHI as specified by HIPAA. Number 4, request to restrict how the healthcare agency uses or discloses PHI regarding treatment, payment, or healthcare services unless information is needed to provide emergency treatment. Here guys, number 5, request that the healthcare agency communicate with the client in a certain way or at a certain location. The request must specify how or where the client wishes to be contacted. Number 6, request a paper copy of the HIPAA notice. Number C now, healthcare agency use and disclosure of PHI. 1. The healthcare agency obtains PHI in the course of providing or administering health insurance benefits. Use or disclosure of PHI may be done for the following. Number 1, health care payment purposes. B, healthcare operations purposes. C, treatment purposes. D, providing information about healthcare services. E, data aggregation purposes to make healthcare benefit decisions. F, administering healthcare benefits. There are additional uses or disclosures of PHI in box number 6.6. So let's read and see box 6.6. Use or disclosures of personal health information. So, compliance with legal proceedings or for limited law enforcement purposes to a family member or significant other in a medical emergency, to a personal representative appointed by the client or designated by law, for research purposes in limited circumstances, to a coroner, medical examiner, or funeral director about a deceased person, to an organ procurement organization, limited circumstances, to avert a serious threat to the client's health or safety or the health or safety of others, to a governmental agency authorized to oversee the healthcare system or governmental programs, to the Department of Health and Human Services for the investigations of compliance with the Health Insurance Portability and Accountability Act for the fulfill and other lawful request to federal officials for lawful intelligence or national security purposes, to protect health authorities for public health purposes, to appropriate military authorities if a client is a member of the armed forces, to accommodate to accordance with a valid authorization signed by the client. So guys, here we have read about health insurance and personal health information. So we were reading chapter 6, box 6.6. Now as you see in the book there is box 6.7 and box 6.8. So my next video will be on box 6.7. We will read slowly word by word. Hopefully you will understand now personal health information data, when we can use and when we cannot use. Then we are going to read again. The next video will be 6.7. For now, bye and see you in next video.